Hi, welcome to my YouTube channel on pain management. Today, I'm going to discuss another aspect of headache called the trigeminal neuralgia. It simply means pain or headache in the part of the trigeminal nerve. So it's one of the commonest causes of facial pain. And it can be one-sided or it can be both sides of the face. What are the symptoms that the individual can present with? One, the patient complains mainly of pain, and the pain is described like an electric shock. And the pain, when it occurs, it can last for a few seconds to a few minutes. And this pain has been described as very intense and severe, and the intensity might increase from time to time. Some have described it as shooting, stabbing, or some simply describe it as sharp pain. And it's also associated with what is called spasm, facial muscle spasm. So the muscle will just become somehow stiff. This condition, the trigeminal neuralgia, is commonly seen in individuals that are more than 50 years of age, and it's commoner in females than males. And one beautiful thing about this condition is that most times it occurs during the day. At night, the patient rarely feels the symptoms, and the face with excessive tearing. Some will have complaint of conjunctival injection. So the eye of the affected side may appear red. What are some of the triggers? Cold air, chewing, and even talking can trigger the pain. So if you are having any of these symptoms, then you need to see a doctor. Do not self-treat at home. When you see a doctor, the doctor is going to specific investigations. The commonest one that you'll be asked to do is the MRI of the head and neck, okay, especially of the head. Now, what will you see, or what do you expect to see on the MRI? It will rule issues like brain tumors, okay, because if a brain tumor is compressing on the nerve from where it is originating in the brain, can cause that. Sometimes, what we call the atriovenous malformation, that is the artery and vein, abnormal one, now compressing on the nerve, can also be seen, or any other abnormality that are inherent. Sometimes it will not show anything, so it simply tells us that the nerve itself is what has issues. So once the doctor has assessed and has found the cause, what will he do? A tumor, due to a tumor, that means you will need a surgery and you'll be referred to possibly a neurosurgeon. If it is due to atriovenous malformation, you will also be referred to a surgeon. So the neurosurgeon to decompress the area of the nerve. In situation whereby it's clear-cut or something that is inherent, seems to be inherent to the nerve itself, then the interventional pain physician will do the following. One, will give you oral drugs, which are special drugs that you will take at home, and then you are expected to come for follow-up, and your blood will be monitored. Your blood sample will be taken from time to time to test to make sure that the drugs you are taking does not affect you. If the drug treatment fails, then the next stage is the interventional pain medication. That is the use of special drugs to inject the nerves at either the point of origin or where it exits from the side of the face, so that the area most affected can be numbed, or the nerve can even be paralyzed. Now, what does the interventional pain physician do? He uses local anesthetic drugs and steroids commonly. You might choose to add the steroid or not, but if it's added, the better. For the local anesthetics, the work or what's expected is that it will block the pathway of the pain, and so it gives instant pain relief. if a steroid is added, the aim of the steroid is to reduce the inflammation, and also it inhibits what we call reversible inhibition of the C fibers. These are small fibers that are very sensitive to pain, so it will also block them and also reduce the inflammation, that is in the reddening around the nerve, so that the nerve can shrink and then the sensitivity to pain can be lowered. So once that the injection is generally safe, it's usually done within a setting where there are equipment for resuscitation in case of any adverse reactions. So but before that is done, you are properly assessed, and then you may be asked to lie on your side, and then the injection is given in front of the ear, that is this aspect of the ear. So once that injection is given, it gives instant relief. Any side effects? Now, side effects can occur or complications can occur associated with the drug injection itself. With the procedure, there might be small bleeding around the area, and then any structure, surrounding structure might be injured accidentally. Even for some, up to the eyeball can be injured. But these are not really common. The common ones, there may be small bleeding at the site. Then the side effects of the drug, if you are allergic to any medication, you need to let the physician know, the pain specialist know, so that he will know what to do. Adverse reactions can occur, reaction to the drugs. Okay, and the reaction could be maybe some skin changes, could be maybe alopecia, the hair will fall off. Okay, for some women who are pregnant, the steroid can hasten the growth of the lungs. So that means the child is maturing faster than expected. That is a side effect. So pregnant women may not be given this at the early. The steroid too can cause hyperglycemia, that's increased sugar level. So after receiving that injection, you'll be expected to come for a follow-up where the sugar level will be monitored. I hope you learned something today. Do not forget to click on the subscription icon and also on your notifications, so that whenever the videos are made available, you can get it. Usually between Tuesdays and Thursdays of every week, videos like this will be. The next time we'll see again, we're going to talk about something else, another cause of headache again. Headache that results from dental pain. Thanks for watching.